Hey folks, San1 here with Vox Herald, and today we've got a story that's sending shockwaves through Canada's healthcare system. Picture this, a major hospital in London, Ontario, discovering that tens of millions of dollars money meant for your healthcare were allegedly siphoned off in a decade-long fraud scheme. That's the bombshell at London Health Sciences Centre, LHSC, where lawsuits totaling over $60 million have been filed against former executives, employees, and contractors accused of rigging contracts, inflating invoices, and using fake documents. This isn't just a financial scandal. It's a public health crisis that could affect hospitals across Canada, including right here in New Brunswick. LHSC is suing former executive Dipesh Patel, employees Lall and Neel, contractor Paresh Soni, and companies Contractors and GBI Construction for $50 million, plus $1.5 million in punitive damages. The allegations claim they manipulated procurement processes, awarded contracts to conflicted companies, and pocketed millions. In a separate $10 million lawsuit, LHSC is targeting former CEO Jackie Schleifer Taylor, CFO Abhijeet Mukherjee, executive Bradley Campbell, and a consulting firm for allegedly ignoring fraud warnings. These claims, untested in court, raise serious questions about accountability in our healthcare system. Why should you care? Whether you're in Moncton, Fredericton, or a rural Acadian community, LHSC is a publicly funded hospital like those in New Brunswick, relying on taxpayer dollars and overseen by provincial and federal bodies, including Health Canada. When millions are misdirected, it means fewer nurses, outdated equipment, or longer wait times issues. New Brunswickers know all too well. Could similar gaps exist in our hospitals? How does Health Canada ensure this doesn't happen again? Today, we'll dig into the roots of this scandal, explore its impact on New Brunswick, and hear from stakeholders across the board. We'll compare Canada's oversight to global standards and discuss what's next to rebuild trust. Have you ever questioned where your healthcare dollars go? Hit us up on X and let us know. To grasp the LHSC scandal, we need to step back and look at Canada's healthcare system and Health Canada's role in safeguarding it. Public hospitals like LHSC operate under provincial jurisdiction but rely on federal funding through the Canada Health Transfer (CHT). In 2024, Ontario received over $20 billion in CHT funds, supporting hospitals like LHSC, a leading teaching hospital serving thousands. Health Canada sets national standards for public health and safety, including financial accountability guidelines under the Financial Administration Act, updated in 2010 to curb fraud following scandals like the 2002 sponsorship scandal, where federal funds were misused. Hospital procurement is a hotspot for fraud due to its complexity. Large-scale projects, like window replacements or equipment upgrades, involve multiple bids, contracts, and oversight layers. Health Canada's guidelines require transparent, competitive bidding to prevent conflicts of interest, but enforcement often falls to provincial auditors and hospital boards. In the early 2010s, Ontario tightened hospital procurement rules after reports of inflated contracts, yet the LHSC scheme allegedly began in 2013, suggesting oversight gaps. Dipesh Patel, appointed VP of Facilities Management in 2013, allegedly orchestrated the scheme, directing contracts to Paresh Soni's companies, Contractors and GBI Construction, without disclosing their close ties. From 2015 to 2024, Contractors received $29.5 million, including $21 million for a window project allegedly inflated by $10 million. GBI Construction billed over $11 million, including $330,000 for a fictitious system. The use of aliases, like Paul Smith for Sony, and forged documents further concealed the scheme. New Brunswick has faced similar concerns. In 2018, a Horizon Health Network audit revealed improper vendor payments, prompting stricter controls. While smaller in scale, these incidents highlight vulnerabilities in hospital procurement, especially in under-resourced regions. Health Canada's role in setting national standards is critical, but its enforcement relies on provincial cooperation, creating potential blind spots. Let's break down the LHSC lawsuits. The first, seeking $51.5 million, alleges Dipesh Patel, Lall, Neel, Paresh Soni Contractors, and GBI Construction engaged in civil fraud, breach of fiduciary duty, and unjust enrichment. Patel, overseeing facilities from 2013 to 2024, allegedly funneled contracts to Sony's companies. Contractors' $21 million window project was reportedly non-compliant, costing $10 million above estimates. GBI's $330,000 fictitious billing and $11 million in payments highlight the scheme's audacity. Forged documents and aliases masked conflicts of interest, violating procurement ethics. The second lawsuit, for $10 million, targets former CEO Jackie Schleifer Taylor, CFO Abhijeet Mukherjee, executive Bradley Campbell, and Corpus Sanchez International for negligence and breach of fiduciary duty. A 2022 confidential report flagged potential fraud, but the executives allegedly failed to alert auditors or the board, signing false audit statements. This allowed this scheme to continue, costing an estimated $50 million. The mechanics of hospital procurement are complex, but relatable. Think of it like hiring a contractor for a home renovation. You get multiple quotes, check credentials, and ensure no favoritism. Hospitals require competitive bids, independent audits, and conflict of interest disclosures. LHSC's allegations suggest these safeguards were bypassed, with Patel allegedly awarding contracts to Sony's firms without scrutiny. The real estate angle adds intrigue. Patel acquired 22 properties worth $9.4 million, and Sony 43 properties worth $14.5 million. Many post-contract, raising suspicions of laundered funds. The immediate impact is staggering. LHSC, serving 1.2 million people, may have lost funds for critical services. Think fewer MRI machines or understaffed ERs. The hospital terminated Patel in August 2024, Lall and Modi in 2025, and contracts with BH and GBI in 2024 to 2025. The lawsuits, filed July 2025, await court testing, but public trust is already shaken. In New Brunswick, where hospitals like Dr. Everett Chalmers face resource constraints, this scandal underscores the fragility of healthcare funding. A similar lapse could devastate rural clinics, where every dollar counts. Health Canada's oversight role is crucial, but its reliance on provincial enforcement highlights systemic challenges. Let's hear from the stakeholders. LHSC's current leadership, led by Supervisor David Museg, emphasizes accountability, vowing to recover funds and restore trust. Health Canada, while not directly named, faces scrutiny for its oversight role. A Health Canada spokesperson stated, "We work with provinces to ensure financial accountability." But critics argue federal guidelines lack teeth. Ministry of Health expressed shock, promising to strengthen hospital audits. New Brunswick's Health Minister, Bruce Fitch, noted, "We're reviewing our procurement processes to prevent this." Local healthcare providers, like Moncton Hospitals, Dr. Marie-André LeBlanc, worry about patient impacts. Lost funds mean fewer resources for care. Patients are livid. London resident Sarah Thompson shared on X, "How do we trust hospitals when this happens?" New Brunswick's Acadian community, reliant on limited healthcare, fears similar risks. Indigenous leaders, like Chief Alan Polchis of St. Mary's First Nation, stress equitable funding. Fraud hurts marginalized communities most. Contractors like BH and GB, I have not publicly responded, but Sony's LinkedIn profile shows no acknowledgement. Former executives Schleifer Taylor, Mukherjee, and Campbell also remain silent, likely awaiting legal proceedings. Advocacy groups, like the Canadian Health Coalition, demand stricter federal oversight, arguing Health Canada must take a stronger role. In New Brunswick, rural mayors like Grand Falls, Marcel Deschamps, call for transparency. Our hospitals can't afford these losses. The contrast between stakeholders highlights a divide. Administrators push reform, while patients and advocates demand systemic change. In New Brunswick, where healthcare access is a perennial issue, the LHSC scandal resonates deeply. Rural areas like Miramichi face doctor shortages and long wait times. Misallocated funds could worsen these. The Acadian population, often underserved, fears reduced services. Indigenous communities, reliant on federal-provincial funding, see this as a betrayal of trust. Nationally, the scandal questions hospital governance. Ontario's Auditor General reported in 2023 that 20% of hospitals had procurement irregularities. Health Canada's guidelines, while robust, rely on provincial enforcement, creating inconsistencies compared to the US FDA, which directly regulates medical products. Health Canada's broader public health mandate struggles with hospital oversight. Internationally, the US's 2025 $14.6 billion healthcare fraud takedown shows proactive enforcement, unlike Canada's reactive approach. The UK's NHS has centralized audits, reducing fraud risks. Canada could learn from these models. The LHSC scandal could lead to tighter procurement rules, enhanced Health Canada oversight, and mandatory federal audits. Long-term, eroded trust may deter healthcare funding, especially in New Brunswick's strained system. Solutions include strengthened audits. Health Canada could mandate annual procurement audits for hospitals, whistleblower protections, encourage staff to report fraud without fear. Transparency platforms, publicly accessible contract databases could deter misconduct. Federal-provincial collaboration. Health Canada and provinces should align oversight standards. Rebuilding trust requires accountability. New Brunswickers, share your thoughts on X. The LHSC scandal is a wake-up call for Canada's healthcare system. Over $60 million allegedly lost to fraud undermines patient care and public trust. Health Canada must strengthen oversight, and provinces like New Brunswick need robust safeguards. This isn't just Ontario's problem, it's a national issue. Let's push for transparency and accountability. Check Health Canada's resources and join the conversation on X. Health Canada recently issued a July 2025 advisory on hospital procurement, urging stricter vendor vetting following the LHSC scandal. They're collaborating with provinces to review financial controls, aiming to prevent future fraud. Stay tuned for updates.